Hello, Revere, and welcome to the July Revere Senior News. I have my co-host here, Steve Fielding, director of the Senior Center in Revere, and myself, Morris. But we have a star today, Dr. Femi Oguntulu. Welcome to the show, Doctor.
Yes, sir. Thank you for having me today.
Right.
Thank you.
And before we start the show, Steve, you have a few things you'd like to go over, so take it away.
First of all, I want to say happy July 4th to all our seniors out there. Our seniors are very patriotic, and testimony to them, they are the greatest generation. And each day at the Senior Center, I don't know if you know this, Doctor, but Morris leads the Pledge of Allegiance at 11 o'clock every day, and all the seniors rise, if they can, and they salute the flag. And he does something that's very, very bad in Boston. Afterwards, he yells, "Go Yankees," because he's from Brooklyn. But in any event, we love Morris, and you know, obviously, we have a good time with that kind of thing. So let me just go over a couple of things, Morris, okay? Yep. So I want to go over the Senior Center events that are coming up. First of all, as most people know out there, we have a special monthly luncheon, and we do this every month where we have lunch and an entertainer come in and sing songs and entertain people. And this month we have Howie Conley's Memory Laners. People may remember them as the Senior Tones, Morris. They changed their name. They play 50s, 60s, and 70s music, and they do all kinds of skits. And one of the best ones they do is they dress up as Sonny and Cher and do some duets, and it's kind of funny. Right. So they put on a good performance. So if you're coming to that, call the Senior Center at 781-286-8156, and you can make your reservation for that. We also have Carol Donovan, our city nurse, that comes down twice a month, and this month she's coming July 5th and July 19th. And what she does is blood pressure and independent consultation. So she comes down twice a month. We also have a monthly hearing program with Mary Marino of Affordable Hearing Aids, and she will be at the Rossetti Cowan Senior Center on July 6th from 10 to approximately 12 o'clock. We have a chair massage person, Barbara McDonald, and she'll be at the Senior Center on Monday, July 9th. She's usually there by 9:30, Morris, and she'll help get the aches and the creaks and help you maneuver a little bit better and warm you up for the day. And the last thing I want to mention in regard to typical activities that we have in regard to people coming down for specialized care, we have a monthly podiatry clinic. I want people to realize that usually it's the first Wednesday of every month. This first Wednesday is July 4th, so the Senior Center is closed on July 4th. So Dr. David Kaplan will be at the Senior Center for Podiatry Care on Thursday, July 12th. I want to emphasize that, Thursday, July 12th. Some people have assumed that he's coming the following Wednesday after July 4th. So I just want to make that clarification.
Did you mention to them about this Senior Gala, the Golden Gala?
It's next on the list.
Okay.
But I have a very special announcement since we're going into the July month, and this is our 35th show taping together, which is pretty cool.
That's very good. Yeah.
I just want seniors out there to know that I have just ordered a 2019 Ford 350 Eco Van shuttle van. It's a 14-passenger van, and with the help of the mayor and the auditing department, we were able to secure funds. And this 14-passenger van will supplement our 8-passenger van and provide much more needed transportation as we see those numbers spike. A couple of things that I want to talk about in particular, save the date, and that's what you brought up, the Golden Gala.
Right.
So this is the second one we've had. We do this every other year. Save September 20th. It's called a senior celebration. It will be from 3 to 7 p.m., okay? It will be at St. Anthony's Lower Church Hall, so there's plenty of parking in the back, and no handicapped accessibility needed. You can park and walk right in to the hall, and we have Alan LaBella, who's a DJ, who's great. Seniors love him. And we have Domino's Restaurant, who will be catering it. It's only $10 per senior, and it's a great night. We had 250 the last time we did this, and I just want people to know that tickets are available only at the Senior Center. And you must see Roseanne Colanino or Marianne Fiore either Monday through Friday between 9 and 12 p.m. And we don't have a maximum cutoff yet, but I'm going to guess it's around 275, 300 max. So make sure you see those ladies when tickets go on sale on Monday, July 9th. One other thing about this dinner is you can come as an individual or you can reserve a table of 10. But you have to reserve your table of 10 and provide those names to Roseanne or Marianne so that we'll be able to secure the tables and make sure that we have them reserved, and as well as the open seating. So I think that's all I'm going to cover right now, because I do want to talk to the doctor, and we have questions for him, and we want to formally introduce him. So go for it.
Doctor, I'd
Yes,
like
sir.
to introduce you again as
you
the
very
star of our show.
Thank you very much. It's good to have you here.
Okay, it's a pleasure to have you here, sir.
It's good to be here today.
For the people in Revere that don't know him, that's Dr. Femi Oguntulu. But you can take it over from here and give us a little introduction about yourself,
Yes.
Doctor.
Well, it's good to be here today, and I appreciate the welcome today that I've had from the Senior Center and Maurice, as well as Stephen here. I'm a dentist. I'm a general dentist. I have been in Revere for close to 17 years now, and we do see a lot of patients, and we see a lot of this senior citizen community as well at our office. We treat a variety of conditions, so there's nothing that they might have that we haven't seen before or we can't take care of. Right.
Right. I'd like to ask you a question, Doctor, if I may. That
Yes,
has
sir.
nothing to do with those. You are a DMD, correct?
Yes, sir.
What is the difference between, let's say, a dentist, an ordinary dentist, and a doctor and a DMD? Is there any difference between them?
You mean a physician? Is that
Yeah.
what you mean? Oh, well, yes. Clearly, we treat the head and neck, the head, the neck region, the oral region. They do mostly the whole body, if you will. We go to dental school. They go to medical school.
How many years do you
Right.
go, if I may ask?
Well, same number of years as they do. So it's 4 years clinical school, grade school. For them.
Right.
Same thing for us as well. Yes.
Steve, I believe you have a question you would like to ask him first.
Yeah, but I do want to give Doctor a plug, because I know him personally, and
Oh.
I have to tell you, he is not just a dentist. He really takes personal care seriously. He's very, very careful to make sure that you feel comfortable, and that you are definitely giving him what he needs to make you better. You're conveying what you need done. So I mean, and he's a very good dentist. So,
Right.
in other words, I feel very I go to him myself, so I feel very comfortable for like almost, I think, about 7 or 8 years, maybe a little
Yes,
bit longer,
yes.
maybe longer actually. I
Longer,
think it's
yes.
longer than that.
Yes, yes.
Anyway, let's get to some questions. How often should somebody get a dental checkup?
At least twice a year. Every 6 months we recommend. Oftentimes we would prefer patients, especially as they get older in life, seniors, to come in maybe 3-4 times a year. It's not too much to do that.
Yeah.
There are more things to see from day to day. The body changes more frequently than in earlier years. So,
Right.
yes.
Now, as an older person, can they still get cavities, if I may ask?
Oh yes, yes, definitely. They would get cavities, depending on, each person is different, but there are conditions that will cause that. Medications they're probably using. Some medications come to mind. High blood pressure medications, maybe anti-seizure medications will do that. The nutrition or dietary conditions may also cause that. Generally, the mouth has a pH balance that we want, and the pH has to be mostly neutral. But once it's not, if it's skewed to what we call the acidic, now that's going very technical, then you may get cavities. Dry mouth. Your mouth become dry at the normal. Sometimes patients know that, sometimes they don't know that.
So that's to keep your mouth moist?
Right, right. So some medications will do that to you. Oftentimes also allergic conditions may do that when they have allergies. People who sleep, who don't have good night's sleep, maybe breathe through their mouth when they sleep with the mouth open. You may also get that. CPAP, use of CPAP for patients who have sleep disordered conditions like sleep apnea would also
I have
have
to
dry
ask you
mouth.
this question. When I was at the Brockton VA, there were 3 or 4 of us in a room. And sometimes at night I would think there was a lion in there with us, you know, the snoring.
Yes.
Does your teeth affect the snoring too?
The teeth don't affect snoring. The snoring is really because of the struggle to breathe when you sleep. People breathe through their mouth either because they have a sleep disordered breathing, like I said, sleep apnea. They have a narrowed airway at the back of the throat where the soft palate meets the tongue. Your airway, you know, where if you ate, you know, where it goes down, that's the airway at the back. If it's not large enough, you struggle to breathe. If you don't breathe through your nose as you should normally, if you breathe through your mouth, the air you take in is what makes that noise as it hits the back of the tongue, right? So the vibration of the air meeting the tonsils or the soft palate at the back of the throat that you hear as the snoring. That's what causes the snoring.
Take it over, Steve.
Well, there seems to be a lot of concern about teeth sensitivity these days, and I guess I have 2 questions. One, what causes teeth sensitivity? And as you get older, does that increase?
Not necessarily. Each person is different, like I said, and each case is different. But this teeth sensitivity also, you know, there are different kinds of sensitivity and different reasons for it. Sensitivity to air, water, cold, heat is one type. Older citizens, older patients, senior citizens will get that, just like anybody else. Sensitivity to biting, to pressure is probably more likely what they'll get because they are losing what is necessary to keep the teeth in place. Maybe their teeth are looser than normal, so it will be sensitive. So you get that in older citizens more than you'd get it in younger patients.
Here's a good question for you.
Yes, sir.
A lot of people have gold in their, you know, in their mouth.
Yes.
Some people have silver in their mouth.
Yes.
Is it a good idea to keep silver? Because some people say pro and con on that.
Yeah, I mean, yes, it's true. Pros and cons. Silver has its uses. Well, let's start with gold. Gold is a very good material. At the back of the mouth,
If
gold.
you could pick, excuse me, sir,
Yeah.
if you could pick between the two, which one would you pick the first one? Would it be the silver? Well, it doesn't make any difference.
Well, I'll pick gold.
Gold?
Gold is better because gold is
But
stronger.
it's more expensive, I guess.
Well, of course, yes. Yes. Gold doesn't break down, doesn't tarnish, it's very strong.
Oh.
And yes, of course, it's very expensive. You don't want it in the front of the mouth. Silver also has its uses, but by and large, it's not something now with technology and advancement in dentistry that we recommend so much. If it's working, I tend to leave them alone until you know, they have no use or they're likely to cause a problem. Then we remove them.
Right. Now, if I wanted to go to you for dental, what's your address, or how would I reach you there?
We've been in the same location for a long time, 2 decades, about almost 2 decades. We're on Square Road, and the address is 252 Square Road in Revere. We're across from the Northgate Shopping Mall. So that's
Do you
where we
have
are.
the phone number people
Yes,
can reach
it's
you?
Cedarwood Dental Care, and our number is 781-286-1620, 781-286-1620.
And your hours, if I...
We're open anytime you want us.
Oh, okay.
But mostly we're open Mondays through Thursday. We're not there on Fridays, but we're open every other Saturday. So that makes up for the Fridays that we're not there. We're open from 9 o'clock till 7 o'clock mostly, 9 to 7.
At night?
Yes, 7, yes. We
Very
do
good.
try to take care of people who maybe travel far or go to work, you know, and need to
Right.
see us, right, yes.
Okay, Steve.
So a lot of seniors have dentures, and some people are under the impression at the senior center that once you have dentures, you don't have to take care of your mouth or your gums. And actually, I've seen people take out their dentures to eat,
Oh, wow.
and because it's too painful for them to eat with the dentures. So I guess my question is there any way they can prevent any problems they have with their gums when they're wearing dentures, or can they do anything to ensure that they're not in pain when they eat with them?
Right. The first thing is they have to have well-fitting dentures. The dentures have to fit. You know, by and large, dentures are supposed to replace natural teeth, and it's never the case. So dentures, by definition, are plastic teeth. They never give you 100% satisfaction like your natural teeth. But, you know, be that as it may, if dentures are what you have, then they have to be as well-fitting as possible to start with. If they are not, then they probably need adjustments. If you have to take them out to eat, then there's a big problem there. You know, there are problems that are associated with long-term use of dentures that are not well-fitting. Patients lose bone. They lose, you know, the denture supporting parts of the mouth, bone, gums, and all that. They, you know, those tissues shrink as time goes on. So they need, those dentures need to be repaired or remade as time goes on.
Question, this is from someone on the computer here.
Uh-huh.
When your dentures are loose,
Yes.
your gums shrink, excuse me, let me rephrase it. Your gums shrink. That loosens your dentures. Do you have to get new dentures, or can you have those dentures filled up to take, in other words, take care of the vacuums that are in there?
Right. So it depends on the, I'd say it depends on the age of a denture. Sometimes the denture that's too far gone, that the patient has had for too long, shouldn't be repaired or realigned if possible. If they can afford it, I'd say if they have the opportunity, just make a new one. But if it's a denture that's just been recently made, I'd say, you know, realigning once in a while is not a bad option, so long as it's not something they have to do all the time, because that would also mean that the denture isn't well-fitting. I have to say something else. Sometimes would advise patients who can afford it to try having implants under the dentures.
Instead of the dentures?
Well, with the dentures. In other words, the implants help to retain the dentures. Those are the best. Those are...
Oh, so the implants, even if your gums shrink, the dentures will still remain the way they were?
Exactly.
Oh,
They tend, so those kind of dentures that are supported by implants do not often have to be remade or taken out of the mouth to eat and all that. You get a lot of positive reasons or positive use from having implant supported dentures. Of course, finances, money is an issue with the implants.
Are they expensive, the implants?
Well, it depends, yes and no, because for some people, yes. For some people, no. There are surgeons who will make it affordable. You know, maybe they give them a payment plan, something like that, to help them afford it. They are the best if the patient can afford them, and if there are no health reasons, no medical reasons that would make that difficult or a non-option. And they don't have to have $1 million. They could have maybe 2, 3. There are different kinds of implants. Sometimes you only need 2 or 3. Sometimes you need more. So sometimes those are the best options.
Are the implants all done at one time, or they're done at separate times?
Well, implants generally are done in one visit. However, the patient may also need, you know, maybe something before the implants are placed by way of maybe bone. They may not have enough bone, so they may have to do surgery before to add some bone, but that's going too far afield. Bottom line is, you know, if the patient can afford it, if they have no health reasons, or if they're willing to do it and the dentist is willing to work with them, implants are usually the best way to go for patients who have it. Without the implants, then the patient is at the mercy of a denture that will fit for a while, don't fit for a long time, have to use adhesive, paste, Fixodent, stuff like that. And, you know, you may get some use out of it, but it's not forever. They still need maintenance, they still need care, and they probably have to be repaired or remade.
Right, so in other words, I see some people at the senior center, they come in and they have a tube, and they use it to fill in their teeth so it's not loose.
Yes.
That's not a good idea then.
Well, that's probably the only option they have. It works if that's what they have to do, but it's, like I said, it's better to have a better fitting denture. Right. If that's what they have to do, then maybe they should be thinking about getting a new one or a reline. A reline kind of fills the space between the denture and the gums where it was, to make it better fitting, maybe tighter, and that way they can get some use out of it.
Okay,
right,
Steve.
I'm taking a look at the clock, so I want to ask a couple of questions,
Shoot.
and then, you know, we'll have to wind down. It seems to go fast all the time when we're on. having a guest. You've been a dentist a long time.
Yes.
There's been a number of technological changes in dentistry,
Yes.
and I'm sure you're aware of them. So I guess I have a two-part question again. You know, what do you do to educate yourself further as these technologies advance? And what do you see in the future of dentistry that might affect people in the most prominent way?
Well, when I say we, my office, take continuing education all day long, all week long, and most dentists do that. And so there are a variety of new equipment that we constantly get into practice, because those things make life easy for us as well. It makes it easy to treat patients. There's convenience, and there's there's affordability as well. Sometimes, something that would take 2 visits will take 1 visit. Something that would take maybe 2 hours will take less time, and we're not going after patients and scaring them. For example, there are digital scanners that we use now. So instead of taking an impression of a mouth with a paste with a gooey stuff that we just scan the mouth the way you would with a wand, and that takes the impression. So the patient doesn't have to have anything in the mouth that they might gag on or retch on, and it's quicker, it's faster, it's more accurate. It's like taking a camera shot of a mouth. So this, yes.
Excuse me, I never heard of the word digital scanner, but is that like an X-ray?
Well,
Or the same? It's not the same.
Well,
as
the same. Well, similar technology.
Oh.
But a digital scanner in this sense is in the mouth.
So you put it in the mouth?
Right. It's like a pen. It's like
Oh.
the pen you have in front of you, and it's sometimes wireless, meaning it's not connected to a cord, or sometimes it's connected to a cord. And all we do is have the patient open the mouth, and we'll move it around in the mouth, and it takes a picture of the mouth, live picture, the same way you have this.
With an X-ray?
Right. Well, with the X-ray, digital X-rays are the norm now, more the norm than anything else. So, but the scanners are different. The scanners work inside the mouth.
Oh, I see.
They take a live picture of your mouth, the teeth, the tongue, the whole mouth, if you will, and so you see it in real time.
Right. Now, some people can get cancer of the mouth, too. Could that come from loose teeth?
Not usually.
No?
No,
Okay.
no, not usually. Of course, sometimes cancers come from no reasons at all. Not because the tooth is loose. That would present its own challenges. But cancer wouldn't come from just a tooth.
Okay,
no,
Steve, you
mostly,
got
yeah.
another one?
No, it looks like I better wrap it up in. We're going to give the doctor.
We still got about 5 minutes left.
All right. I'll ask one more question.
Go ahead. Then I have one more real quick one, which is very easy.
All right. So.
Okay. So I guess when people take care of their teeth, they should brush regularly. Try to brush more than once a day. What is the best technique to use to brush teeth? That's the best way we can maintain our teeth, is to make sure we use toothpaste.
Well, for older citizens, for seniors, I would say if they can, an electric toothbrush is probably a better way to go for them, because sometimes they have conditions like arthritis and stuff like that make it difficult for them to maneuver their hands.
Right.
So the use of an electric toothbrush is, I would say, is advisable, and the better way to do it is go gently from side to side. The toothbrush does most of the work for you. You don't have to do a lot. Try to avoid brushing hard, of course. Moving your head from side to side while the toothbrush itself is moving from one end to another is a good way to go. The idea is to remove plaque. If plaque is soft, if it's recently been in the mouth, it's easy to remove. It's when it becomes hard that it's a challenge, and hard toothbrushing wouldn't remove it. You'd have to go to the dentist or the hygienist every few months to have your teeth cleaned out. The right way and polished the right way.
Real quick on this one here, Dr. Femi. Some people like to have their teeth white.
Yes.
What are good things to make them whiter, if I may ask you?
Well, different things. Toothpaste work now.
Yep.
They have very good toothpaste that work. There are strips that you simply just get over the counter and open up and put over your teeth, and they stay there for half an hour to 45 minutes, and they do whiten as well. And they also have trays that you take home with you that will also do the job. And they have gimmicks that how do I say, they work by themselves. You put the tray in your mouth and the light shine on the tray and it whitens your teeth. And then you have the big one where you go to the dental office, they put you in a chair and do Zoom for you. So there are different ways.
Okay,
Yeah.
real quick.
Yes, sir.
seniors can have braces too, right?
The answer is yes, but my question is why? You can have anything you want, but yes, why? If your teeth are strong enough
Right.
and your teeth are in a very good place, yeah, you could. But mostly seniors with teeth that are loose, no. I would
Okay,
say no.
that's it.
Right.
We got a couple of minutes left. Take a minute and a half to wrap it up,
Yes,
Doctor.
I really enjoyed being here today. I know a lot more now, more about what you do in the program for the senior citizens, and I wanted to say it's a very good program. I'm very happy I'm here. You can call on me anytime. You do very good work. Stephen here has been a friend for a long time, a patient, and I wanted to thank you for letting me be here to contribute to this.
Steve, I would like to make a suggestion, if I may, here.
Sure.
As director of the Revere Senior Center, it would be nice if you would invite Dr. Femi to come down to our senior center sometime and do the same thing in front of all the seniors.
That might be a good thing. Definitely.
I will
Definitely.
be honored to do that.
It would be an honor to
I'd
have
be
you,
honored
my
to have it.
friend.
And a happy 4th of July to veterans, senior citizens as well. And thank you very much for everything you do and for having me today. Thank you.
Right,
Appreciate it.
Steve might not have mentioned this, but I'm also a World War II veteran.
I thank you very much, sir. I
Right.
appreciate it. I appreciate it. And to
Right.
you, your family, and everybody else, thank you again for
My
everything you
brother, my late brother was a Korean veteran.
do. Wow,
Yeah.
wow, thank you.
So
Appreciate it
we
very
had a
much.
couple of
That-
veterans in our
thank
thing.
you. I
But I
appreciate it.
always
Thank
joke
you.
about being a World War II veteran. But I won't now because we only got a minute to wrap it up. So Steve,
So-
take an extra minute and leave me 20 seconds.
Okay, so what I'd like to do is reach out to seniors in Revere who either have heard about the senior center and haven't come down, or people who haven't heard about us at all. We're located at 25 Winthrop Avenue, and it's a great, warm, safe, inviting environment. It's very positive. It's a fun place. We have numerous activities. If you find yourself out and about the city of Revere, I publish a newsletter every month called Revere Senior Power, and we always have a little bit of a write-up. We have a menu because we serve approximately 50 seniors a day. We have all kinds of activities. They're located on the back of the Revere Senior Power newsletter. We have many health and exercise classes, book clubs, computer club, iPad classes. We play bingo. We have a movie club. We have a lot of things going on at the Senior Center. Morris is there every day. He plays music, and I think that's a wrap for me, right?
Yep.
Okay.
So I want to say, Dr. Femi, thank you. It was a pleasure and honor for you to come down.
Thank
God
you.
bless you.
Thank
too.
you very much, Mark. Thank you very much. I
Right?
appreciate
God
it. Thank
bless
you, Stephen.
our
Thank you.
troops,
Appreciate it. Thank you.
the people of Revere, and I hope you tune in again for another great show with another great star like Dr. Femi Oguntulu. Thank you again, sir.